The Uganda Aids Commission, although not well-resourced, continues coordinating the HIV response at national level jointly with the Ministry of Health. By 2022, the country registered a total of 52,000 HIV infections, of which 17,000 were sexually transmitted, with the victims aged 15 and above. The head of prevention at the Uganda Aids Commission, Dr. Byamukama, has said the stakeholders' aim to end the AIDS epidemic is not dependent on whether or not they have the vaccines, but rather on self-responsibility of the patients to do the needful.
Ending the epidemic doesn't mean there will be no people with HIV. There are people who are with HIV, healthy and vibrant, because they are taking medication very well. They are not dying from AIDS-related illness. And because they are taking their medication very well and we are not stigmatizing them, they are not transmitting HIV to anybody. Without cure, without the vaccine, we are going to end the AIDS epidemic if each one of us plays their part effectively. You can prevent a sexual violence. You can help a child stay in school, most especially a girl child. You can take your ARVs as advised by the doctor.
He gave assurance of continued supply of ARVs regardless of recent withdrawal funds by some donors.
The President has clarified whether the donors stay or go, the ARVs will be, nobody will buy ARVs. The government is
with the female population, especially those between the ages of 15 to 29, being noted as the most vulnerable, Dr. Byamukama said the Commission has initiated programs to help women and girls from continuing to contract the disease.
So some of the interventions address beyond an individual girl. We visit the family's home. Because some families are so toxic, they are putting down the girl. So we help educate the family on how they can be supportive to the girl. We even go to the community. Some communities are busy marrying off the girls. So our program for adolescent girls and young women, as I said, is multi-sectoral, so many prayers, it's comprehensive, focuses on individual, focuses on household, focuses on the whole community, and most especially looks at an individual. What is your immediate need?
HIV prevalence appears to have fallen among all age groups in Uganda population-based HIV impact assessment compared to UPHIA 2016-2017, except among older individuals aged 50, 54 and 60 to 64. The 2023 HIV Symposium will be held between 14th and 16th November 2023 at Kololo Ceremonial Grounds under the theme My Responsibility Towards Ending AIDS by 2030, falling under the End AIDS by 2030 campaign.
Adolescent girls and young women, the response is a true multi-sectoral response. Each piece is contributed by the various sectors. But I want to start by emphasizing that the most vulnerable girl we have in the country is the girl out of school and unemployed. So one of our key programs for the adolescent girl and young woman is to keep girls in school. And the government has done so much. But even when they are put universal secondary education, universal primary education, a significant number still get out of school because of various reasons.
This is news at 8.